it all brings us back to the what sickle cell is. As I've mentioned earlier, it is a genetic disorder. Both parents must have no, the normal one is the hemoglobin A, normal hemoglobin. But a person with sickle cell has hemoglobin S. So mama and baba, you'll have hemoglobin SS. You get. So if I'm your wife, you have hemoglobin S, I have hemoglobin S, we give birth to children with sickle cell. If I don't have hemoglobin S, I have the normal one, you have, then we may give birth to healthy children. But they are carriers.
Oh, so it means they are children.
Yes, their children, if they meet partners, those partners will, if they're not educated, then they will also get children with sickle cell.
Hey, karibu sana to the biggest conversation in the 254. You know how we do. We bring you the best stories, good vibes, and of course we have something you can learn every day. So joining me today for the very first time, we have the beautiful Miss Lilly. Karibu sana. And we also have Meshack. Karibuni sana to the show. You are our very first guest, so we are excited to have you. So, asante. So today we are handling one of the conversations many people don't talk about, and it is sickle cell disease. So we have Lilly. She's a pharmacy practitioner, and she's also a businesswoman. And we also have Meshack, who's one of the sickle cell warriors. Karibuni sana to the show. Lilly, we are used to seeing medics wakiwa na sura ya kazi. Why are you different?
I was born a happy child.
Okay. Yes. It's the very first time naona medic ana smile and you're easy and all that. Looks like vitu zina change on the other end. Ama ni wewe tu?
It's just me, but I believe the first time you met me, I wasn't this all smiles.
I know, yeah. Yes. Okay, well,
so
not...
familiarity.
Oh, okay.
Yes.
Imechangia kidogo.
Yes.
Sawa. Meshack,
Yes.
karibu sana pia.
Thank you so much.
Nimepatia Lilly introduction kubwa na nikakusahau kidogo.
No problem.
Karibu sana to the show. So Lilly, you are passionate about sickle cell disease.
Yes.
From the very first interaction nimekuwa nayo na wewe, I've been seeing the work that you do and just how you put in so much. But then my question is, why sickle cell disease? Mbona si malaria, kaswende?
Now, for me, sickle cell is close to my heart because I got to learn about sickle cell. Of course, being a medic, I know what sickle cell is, but I didn't know the impact until I had a domestic manager who took care of my children for the last 15 years. And she had a daughter who had sickle cell disease. And the mother really didn't understand what's going on with the child. So, they were living in Mama Lemba, they still stay there. And many a times, she'd be called, the child is sick, and we'd run all the way. We are driving fast, we're going there and finding a child in crisis, she can't breathe. And we're all mixed up. And that little knowledge you have about sickle cell, because you see, I dispense medicines. I serve people in the pharmacy. So it just didn't make sense to me. I was asking myself, hey, kwani this child, what is wrong? So we'd go to the referral hospital, get admitted, and it's crazy. They're accused there. The child can't breathe. We are taken to casualty, and they are resuscitating her. They need blood, and you know how blood is a challenge. So we end up, myself and my husband, donating blood, to save this life. So over time, that would continue happening, and I'd keep giving her medication. Then I got to tell myself, no, I really need to understand this disease because it is hitting right here at home. Instead of supporting other people and helping people and, we're just dispensing, what is sickle cell? So I got to start learning. I started attending seminars. I started attending forums where sickle cell is being discussed. I got inquisitive. I started reading, researching. And then I understood, okay, so this disease is like this. So I started supporting her, giving her the medication that she needs so that she doesn't get crisis. And of course, supporting her with the necessary food and supplements just to improve her wellness because she had lost so much weight. And as I had mentioned, the mom did not really understand sickle cell. So that is what my reason, because everybody keeps asking me why sickle cell. And apart from that, over time, I've gotten to realize there is a crisis. You know, everybody has focused on malaria, on STDs, on HIV, on young women, pregnancy. Nobody ever thinks about sickle cell. And you know what? It is worse than all these diseases I've mentioned. Because one, people don't understand it. Even the parents who have sickle cell children do not, or adults themselves, they don't even know what sickle cell is. So it really needs a lot of advocacy. It needs a lot of sensitization. It needs a lot of awareness. It's just a sad state.
So you're basically saying this lack of information is where is what has gotten us to where we are right now.
Yes, yes.
So why
Because
don't-
even the medics, even the medics themselves, some of them do not even understand sickle cell. You know, I currently we have our database has 520 warriors, and they come to our facility under the Zuwi Afya community-based organization that I founded in 2021. They're able to come to our facility and get their drugs for free. Hydroxyurea, proguanil, Pen-V, painkillers. We have a facility. We work together very closely with my pharmacy, which is Zui's pharmacy at Alimran Plaza. So we are able, the pharmacy is not just any pharmacy. We believe in having a one-stop shop where you come and get services. You need medicine, but if you're feeling like you have malaria, we can check you. You feel like you have challenges, there's a medic there's an MO there to give you some consultation. We have a physio, we have a laboratory, a fully certified laboratory. So we are able to give services very well. And I've taken advantage, and that's why I say we work closely with the pharmacy, because the warriors tend to have crisis. So we're able to give them at least some emergency services outpatient before transferring them to the medical facilities. Yes.
So before we come to you, Meshack, to give us just what it means to live with sickle cell disease, I'd like to take you back kidogo, Lily, because now, like we said, we don't have information.
Yes.
So why then don't we start at a point where we define for the people watching, is sickle cell ni nini exactly? How does it happen? Na ina nini aje?
So sickle cell is it's a genetic blood disorder.
Right.
And it is not gotten from one parent. It is not gotten from uko. I mean it is hereditary, but it has to be mother and father. When a man and a woman have the sickle cell genes, they give birth to a child with sickle cell. You see, sickle cell is a disorder of the red blood cells that it affects where the normal red blood cells are round in shape. But a sickle cell warrior has the blood cell is S-shaped. So when it's S-shaped, that's why they're called sickle. Now this S-shape is gotten from both parents. We've had so many cases of gender-based violence, women being chased away, victimization, stigma, especially on the women, because men believe there's no way they can have that disease. Like today, we've been to, I was called for an emergency in Sangoro. And sadly, when I got there, this child has not been in school for 1 week. She does not have medication. They have no information about sickle cell. The mother knows just basically there is sickle cell. And you know, I got very shocked because the mother is not there. And she's in Kericho trying to fend for the children. So these children, there are 5 of them. And they've been left in the custody of their grandmother. And the grandmother is making them work for them to survive so that they're able to get food and they're able to go to school. As it is, when I was called by a fellow, one of the founders from another organization, LACOD, another person reached out to her and told her, because she stays around that area. She'd gone to the village for the weekend, and she got to meet these 5 girls. And one of them was very sick. Her hand was wrapped in a kitamba, and she was in pain. So she asks them, Kwani, what's up? And you know, they're dressed in tatters. So she asks, what is the problem? And they sit down and tell her, you know, our sister is very sick. She has sickle cell. She's not been to school since Monday, and she has not gotten care. So she was so disturbed, she runs to the nearest pharmacy in Sangoro, tells them that they have a child who's having pain. How can they help? And they tell her they do not have medication. So she decides to get in touch with the Kisumu people. Most of the people know what we've been doing on the ground. So she asks, do you know an organization that deals with sickle cell? And the first people they tell them is us. Now, I was to have a meeting with her on a totally different aspect. We're just to get to know each other. What do we do? Because in this field, the CSO world, you have to work together with various organizations. You cannot pull through. We might be good in this, another person is good in. As I've mentioned, there's GBV. Yes, under the health scope, which is one of our thematic areas, we have GBV. But there are people who are experts on GBV. So when they called me, we rushed there, and I sat down with the people in the community, the grandmother, the uncle, the aunties, and I'm asking them about sickle cell, and they have no information. Do you know? And you have a child who has sickle cell in crisis here. So we had to call the mom. Now I get history because I was asking them. This child has sickle cell. The child herself knows. So I ask her, you have sickle cell? She's around 11, 12. She tells me yes. How long have you had sickle cell? Since she was born. Are you on medication? No. She's not been on medication for a while, but she's normally given hydroxyurea. So I asked her, so where have you come from? Grandma had sent her to look for change. Almost over a kilometer. This is a warrior who is in pain. It is scorching hot. She's dehydrated. Her lips are dry. Already, why wouldn't she have crisis? And I'm talking to the parent and she has no idea. She's telling me, I'm asking her, you have sickle cell? She tells me, no. Iko uko kwa uko. Then now on the phone, I'm educating her. You know, for this child to have gotten sickle cell, you and your husband must be having the genes. And so I ask her where the husband is. She tells me he died. What did he die of? He died of pneumonia. Was he on medication? No. Already the red flags are there. So why I'm giving this story, it all brings us back to the what sickle cell is. As I've mentioned earlier, it is a genetic disorder. Both parents must have the normal one is the hemoglobin A, normal hemoglobin. But a person with sickle cell has hemoglobin S. So mama and baba, you'll have hemoglobin SS. You get? So if I'm your wife, you have hemoglobin S, I have hemoglobin S, we give birth to children with sickle cell. If I don't have hemoglobin S, I have the normal one, you have, then we may give birth to healthy children. But they are carriers.
Oh, so it means they are children.
Yes, they are children. If they meet partners, those partners will, if they're not educated, then they will also get children with sickle cell. So you see how people, the understanding of it's iko kwa uko. It is not uko. It is about educating the community. And you know, we had to do this there. And they're like, okay, so hapa ndo kuna shida. So, and then I tell them, you see, when it's S-shaped, when the hemoglobin is S-shaped, it struggles to pass through your veins. And that is where now crisis, it's called vaso-occlusive crisis, VOC, whereby the S-shaped hemoglobin, it's struggling to pass through your veins. It gets stuck on your joints because it can't flow. And that is why they get crisis. So you get a sickle cell warrior, mikono zimefura, miguu zimefura, they're in very bad pain because blood is not flowing properly. We're together. Then another thing, when your hemoglobin, basically in a very simple science classes that we learned in school, you know, hemoglobin gives oxygen for the blood. So if the oxygen is not healthy, what happens? Your organs will be damaged. That's why warriors they suffer strokes, they go into comas, they are getting disabled because iyo damu mbaya hiyo, sorry to use that term, but because the hemoglobin is S-shaped, it is going to attack various parts of the body. It loves the joints. And that's why you find that warriors are disabled. Recently, they were gazetted as people with disability. And you know, one of the things we're trying to advocate when a child is born with sickle cell, for as long as I love the fact that Dr. Wanda has initiated, it's a program at the referral hospital. Every child born must be screened for sickle cell, and that is a very good initiative. These are things that were advocated. There's a fellow founder from Tumaini Sickle Cell Foundation. She does a lot of advocacy and also sensitization. She does a lot of education on sickle cell. And those are the things, she's in platforms where for human rights and advocacy. These are the things she's really fought for. Because when you do early detection, then we will not have these issues. So she would do advocacy as much as I would do it, because there are a lot of people affected by sickle cell. But at the same time, being that I am a medic, I'm able to give the service, the medical service. So sickle cell goes to attack. Now, when the red blood cells are S-shaped, you know red blood cells form hemoglobin. Remember, this hemoglobin is because it's S-shaped, it's not healthy. And as a result, you don't form enough iron. So they have, you notice most warriors have yellow eyes. That is the reason. So that is why warriors must take folic acid, not just any medicine for iron. People need to understand we are trying to fix the hemoglobin, not their blood. They are given folic acid to improve their hemoglobin levels. Because most warriors, one of the things, there'll be crisis. Another thing, their HBs will be low, as I have explained. And when this happens, if you have a HB of less than 3, you are just basically dead. So we try as much as possible to give them folic acid, which improves their HB. Hydroxyurea is a very key drug. It is used to improve the hemoglobin. Sadly, it is very pricey. I know Veronica is in spaces where she's trying to advocate for these drugs to be given for free, just as much as HIV drugs, because there is a crisis. And we are trying to do the same. But, you know, before the government rules this out, they have made progress. Through Dr. Muyonga, who's a pediatrician, they have set up Victoria Annex. They've set up a sickle cell clinic there. They are currently doing outpatient. But the biggest challenge is you must have SHA for you to access those services. We also work very closely with her because on our side, it is heavy. Already we have 520. We are struggling, but we are soldiering on because God is making a way. Somehow, being in the pharmaceutical industry for over 20 years, from my networks, from family, from friends, and a very supportive spouse, I have been able to support these warriors up to where we are. Meshack can attest to that. He's just one of a few. So the hydroxyurea helps the hemoglobin to be at least healthy. It helps to produce better hemoglobin, therefore reducing the crisis, and therefore the blood can flow easily. So this is where the problem is. Access to this hydroxyurea. People are selling it at whatever prices they can. Most people sell it at 50 bob per capsule. That's 1,500. I've given you an example of this warrior we've gone to see. They are working for their grandma so that they can go to school and to eat. Tell me where they're going to get that 1,500 to buy hydroxyurea. These are the things, and this is what I saw from the girl I supported, the lady, the small girl. She's now a lady. She's 15 years. She's called Faith Munyasa. Sorry, Favor Munyasa. Faith is her sister. Favor calls me mom because she can call me anytime. Whatever she needs, I don't even think twice. If I don't have, I'll look for it. I make sure she has the medication. I make sure she has painkillers because crisis can come anytime. I make sure we give nutritional supplements. I make sure she has nutritional feeds. Ile hata kama wamekwama kabisa, anaweza koroga, it's a nutritional flour. Anaweza koroga na akunywe and she'll be strong. That girl is a real warrior. She has fought and fought. She does so well in school. She passed in standard 8. She's about to do her form 4 and she's an amazing girl. She's beautiful. So what I tell guys is there's joy beyond pain. These warriors go through so much pain. But if they're able to access the right medication, and that is where Zuwi Afya comes in. And it's not just there. We also ensure that they're healthy. then we take them back into the organization and we do the activities together. Meshack,
Yes.
we do quite a lot of things with him. I look for opportunities where they can get empowered. We have a farm. We teach them how to farm, we teach them how to keep cuckoos, we teach them how to put goats. And from this produce, they're able to get one or two. We are also, we have programs on waste management, whereby the healthier members of Zuwi Afya do the hard job. The warriors, they will do more of paperwork and, not very heavy work because they're not supposed to overexert. Already they're very delicate. So we get the waste, we segregate, we have a shamba, the organic waste, we turn it into fertilizer. They learn from that. Then the plastics and what have we recycle them with another program with another organization called Eco Charlie, where this plastic, we are able to make other produces that we can resell. So there's quite a lot. We don't just get them healthy, but we're trying to see how can they be able to afford a meal to survive. Yes.
That's some beautiful work you do with the warriors, and especially with the Zuwi Afya CBO.
Yes.
And I can see from the way you explain passionately, and you even know these victims by name. Sorry, I call them victims.
No, they're warriors.
The warriors, yeah.
Yes.
You even know them by names, and the fact that you even go beyond just providing medication, you even facilitate them in other areas, which is some beautiful work. But I'm taken back because I grew up nearly grew up Ushago. And if you grew up in a setting like mine, ulikuwa unajua that ugonjwa, the way we used to treat diseases ilikuwa so casual. Like every single thing ilikuwa, hiyo ni malaria, mpatieni Panadol. Hiyo ni malaria, mpatieni Panadol. So ama huyo amerogwa, ama huyo anafa, such kind of stuff. So do you think kuna aspect ya misdiagnosis na vitu kama hizo because of the way we casually treat this, and do you think that has also contributed to the crisis?
Yes.
And as you talk about that, I'd also like us to talk about the numbers, because as I was looking this up, I saw that the Ministry of Health inasema that saizi about 14,000 children annually are born with this.
Yes.
So do you think an example kama hiyo yenye nimekupea, because you work with them, do you think an example kama hiyo yenye nimekupea where we used to treat diseases casually and mostly juu hatukuwa tunajua and our parents and all that, do you think ime contribute sana?
Oh yes, actually the biggest contributor is myths. Myths, stigma, and of course lack of information. But I also love the fact that with the advocacy sensitization that we are doing, and what was recently introduced, the numbers will come down. Because you see, when you have compulsory screening of the newborns, trust you me, treatment starts from then. The minute you're educated, and after the education, you keep coming for clinics. You have arrested the problem. So it's work in progress, and it's actually escalating into something good. But now the problem is, this is us in Kisumu town. I've just mentioned to you, I'm from Sangoro. We went to help one child out of five sisters. The others had gone to school. They're not sick. In a span of 30 minutes, we had almost 10 other people. And they have children with sickle cell. They don't understand what sickle cell is. They even think it's unaambukizo ukigusana. It is sad. And we didn't even have that much time. So we were able to help 3. A child was practically brought from school. He has the mom brought him. He's not been on hydroxyurea for a while. And we screened him, we checked for malaria, we checked his HB, and we gave him hydroxyurea, folic, and painkillers. And the mother was so happy. I went there just to help. And here is a mother giving me groundnuts as gratitude. It really touched me. And I told them, you know what, talk to your chief, talk to the community health providers. We'll be back. Just tell us when. Bring the community together. We'll come and sensitize you. But in that short span, we educated them. And the border, as we were leaving, people are calling us, can we come? And we told them, no, we will be back. Just plan something at least well planned, and we'll be back. We'll bring you medication. We will answer your questions. We'll come early in the morning. We won't be in a hurry, because sadly we had already had plans for something else. This was an emergency, so I had to push up my appointments just to take care. Because for me, trust you me, even if a warrior calls right now in crisis, I will stop this podcast and go and help them, because that is me. Yes. So the numbers, yes, they've been crazy. There are a lot of myths. People believe sickle cell is kurogwa. Sickle cell is ugonjwa ya mama. Sickle cell mtu hawezi pata. You can get it mkigusana. You know, as in very bad myths. So we're trying to expel those myths and educate the community and even parents that this is sickle cell. There's even a home we went to. A sickle cell warrior had been closed in the room. Hafai kuingia kuinteract na watu wengine, hata na watoto wengine, and they feel like she'll infect, until we told them, you know, this disease, sadly she passed last month. We told them, you know, this is you and the husband, parents, you're the ones who gave this child this, and have all the other children been screened. Just the fact that they're not sick, unapata, just the way you've told me, unauma na mguu unakunywa panadol, ama unaenda unaitisha fansida unakunywa. Today a guy was seated next to me, we checked him for malaria. He's telling me he's been having joint pains. Remember, this is the same guy that this girl that we went to treat ni uncle yake. Are you saying chances are he's a sickle cell warrior and he has no idea? And one thing I want to tell people, sickle cell is just like any other disease. The way diabetics live to even 100, the oldest sickle cell warrior is 80. So people need to stop cheating each other. So your child won't reach 5, your child won't reach 18. You can live your life. For as long as you have hydroxyurea, you have folic, you have paludrin. Paludrin is to prevent malaria. You are so good to go. Yes.
Sawa. So before we come back to you for treatments and what the government is currently doing, I'd like to talk to Meshack. So Meshack, thank you so much for coming, and we love to see that as a warrior you keep also working with her as you help other warriors. That's some very good job you're doing. I'd like to tell us your story. Take us through when this started and how you've been, some of the most difficult things you have had to go through, and also some of the victories you've won that you think will inspire someone out there.
Okay, first and foremost, thank you so much for giving me this chance. Like she has said, sickle cell is just a genetic blood disorder. Yani ni kitu chenye natoka kwa damu. Yeah. So according to my story, I will be short. Yeah. Life has not been easy. Yeah, because ni kitu chenye nilizaliwa nayo. I was born with it. Yeah, and I agree for that. I should not blame anybody, because even they do not know. Even my parents, they doesn't know. But according to me, actually, my sickle cell case started when I was 5 months. I was told like that because nilikuwa nalia juu ya pains. Kwanza inashika joints. Yeah. And before that, kwenda hosi ilikuwa noma because mi nimetoka interior. Yeah. Pale inaitwa Chemelil. Yeah, na hosi tulikuwa tunakuja Russia. You find that a difficult transportation. Ilikuwa high.
Ni mbali, that's some distance.
Kabisa. So I walk this walk with my mother. She's the one who has been beside me before I found Zuwi Afya members. Yeah. So life was not easy, like I've said before. Unapata mara ukikuja hosi, unapata wanakupea hizo painkillers, unarudi. You see? Yeah. Actually, I didn't believe that I can get something which can sustain my life. Yes. Yeah. By that time, I didn't know any medicine for sickle cell. Sikujua. Yeah. But I thank God for life, because it is just a case of managing life. Yeah. And many people, I just want to talk many warriors know that when you have a sickle cell, you might die any moment. You see? Because ni kitu chenye natoka kwa damu. Not like that. as long as you know how you should manage your life, you are free to go. You can stay for more than you want.
So I'd like to know hii imeaffect aje relationship yako na say marafiki, ilikuwaje hapo shuleni ukienda?
Okay.
Kuna any form of stigma ulikuwa unapata? Kuna any form, kuna marafiki walikuwa na discriminate ama kitu kama hiyo?
Yeah, actually, according to me, when I was growing up, I started avoiding friends up to date because they were afraid of me. Why? Because I was sickler. Because sometimes maybe when you are in class, you don't know, unaanza kusikia crisis, and you find that they are running away from you. You see, when you told someone or when you tell someone, get me a glass of water, no one. So I had to start planning my life. I was going with my bag, carrying my medicine and water. When I was in primary school, no one stand with me apart from my mother, because there was no any money. Getting those medicine, they were expensive by that time. Even at right now, they are still expensive. So I was just managing life the way I've said, you see. Yeah, so I thank God for I finished. I do that, and I was strong. When you have a sickle cell, you need to be strong. Yeah, you accept the life, and you be strong. You see. First, in primary school, I've told you about that one. It was not easy for me to finish class 8. It was challenging. I did my KCP exam when I was in crisis. I was admitted by that time, actually, and no one was there for me. Yeah. So you just be the way you are. Yeah, and you pray to God. As long as you have your medication, you are going for checkup, you need to go. So I finished my class 8 and I joined secondary school, which I did in Kericho. So when I was having sickle cell, this thing did not prevent me of achieving my dream. Yeah. I had to pray to God to give me another chance so that I can be the warrior. Like today, I can tell my story, even though it has not been easy. Yeah. So I finished that secondary. I did it in Kericho. After did my KCSE, I started life as hustling. You see, yeah. And today I'm here. I am thankful.
Ah, good. Yeah, and definitely your story, I know it's inspiring to other warriors outside there. So because you've mentioned crisis a couple of times, nataka uniambie hii time ya crisis inakuanga aje, and ni moment gani ile ushaikuwa nayo ya crisis ukasema now this is the worst nishaikuwa nayo?
Okay. Thank you for that question. First, crisis. You see, right now I'm talking to you. You can see me that I am normal. But the following minutes, you can't tell this was Meshack. Ni kitu tu chenye nakuja. It happened. Actually, I usually say that the moment I spend with you, the moment yenye na hesabu. Because I do not believe that tomorrow is there. But before I found Zuwi Afya, siku hizi nimejua life, kuna life. Even if you are a warrior, there's still life. Sasa pain, crisis is a pain, and inakuja saa yoyote. According to my issue, I usually experience this in the morning and evening hours when there's a lot of cold. And that moment, you need to put a pullover. And you need to put something warm. And another thing again, you need to have your medication cover. You need to have your medicine, be it painkiller, folics, whatever. You need to have them, and you should not go without taking them every day.
Okay. Sawa. And imekuwa affect aje this whole thing, especially now hiyo point ulikuwa unasema some friends wanakuavoid and even now you still say unajaribu kujiseclude kidogo and understandably so. Imekuwa affect aje psychologically?
Okay. I was not born like the person who had PWDs. I was not like that. I was just a normal person since I went to Russia. By that time tulikuwa tunaenda Russia for checkup. My parents did not know about the case of sickle cell. Yeah. So kuna daktari mwingine Russia alikuwa anaitwa Dr. Raburi. She's the one who operate my body first, and there was complications of joints. So I was supposed to come back for checkup, and that one during 2007, there was a war in Kenya. So we didn't manage to get the cast out of my leg. You see, so the cast which was put on my leg is the thing which give me another problem. Yeah. From that day, I usually sometimes I said I should not go to the hospital, because when you go there today, you are be given come tomorrow, come the other day. You see, so I usually manage my own life. Even if I am in crisis, I need to call her and inform her. Yeah.
Sawa. Na huko home area yenyu mali unatoka, did you ukigrow up ama hata saa hizi umeencounter other cases kama yako?
Actually, cases of sickle cell are there.
Hapo sasa home tu kabisa.
They are many. Yeah. But getting someone who can stand with them is difficult. And someone who can preach them how to take good care for the warriors is a bit difficult. You see. But actually, we found a Zuwi here. Zuwi actually is doing a great job. Yeah. She is doing a very great job. That pharmacy stand with warriors. Yeah.
Sawa sawa. So before I'll come back to you, uniambie venye ulimit Zuwi and how you've been walking the journey together. But now Lilly, I'll come back to you. Juu sasa tumeona tuko na crisis and we've seen the numbers are scary, so to say. And you're doing a wonderful job with the Zuwi Afya CBO and your other partners. I'd like to know, sasa sahizi tuko hapa, right? Tushagundua maybe tuko na mtoto. We don't understand what's going on. I want you to walk me through as a parent. Mimi ni parent, we just had a baby and we've started, ni signs gani tutaona, and once we've seen the sign, ni tests gani tunafaa kukuwa nayo, and then now slowly now put us through the treatment options that we have.
All right, thank you for that. So it's pretty easy. You know, when you get a disease that you have no idea about, it's just like COVID, you know, it's really shook people. And I feel like sickle cell is more or less like that. When you get a child, as I mentioned, I really thank Dr. Awanda for coming up with the free screening of the neonates. But here's a situation where in the village we've gotten a child who has, you know, these children cry. My dear, that child can cry and you're asking yourself what, of course there's colic. Most children are born with that and they really don't understand. But the pain of sickle cell is abnormal. The cry is very different. That child can cry and cry. You know, with the colic, you can give a painkiller, even paracetamol, and the child is fine. But yeah, sickle cell, my dear, utalia na ulie, utapeana painkiller, you will be asking yourself, what is going on with this child? So, first of all, they will do the basic tests, malaria tests. You know, we are in a malaria-prone area. Do malaria tests, you do a full hemogram just to check if there's an infection. And one of the things you'll notice with sickle cell warriors, there'll be abnormalities. When you do a full hemogram, the first thing that will be abnormal is their HB, the hemoglobin level. That is the first red flag. But very few people also know that. For if you go to a proper facility, they'll note that. And the first thing they'll ask you is, mko na ugonjwa wa sickle cell ama selemundo kwa family? People don't even understand what that is. A good practitioner the first thing they'll do is run a sickle cell scan, which is it's just like a malaria test. Easy kama as a HIV, it's an MRDT. And on that note, we have those scans. We have a really good, we are actually selling them. My pharmacy has gotten quite a number of them. They're from the US, and they're pretty good, efficient, accurate. Some of the MRDTs, not to criticize or to thumb chests, but it's a pretty good, having worked in the sickle cell space, I feel the need of having quality products. So we have one called LOL. It's an MRDT, just like these HIV scans where you unajiprick. You can do it at home, or you can come to the facility. We're able to check you, and then after that, of course, this one is accurate. It will tell you whether you are a carrier, whether you have the gene, Then after that, if there are those who say hapana, so unajua HIV lazima ufanywe confirmatory. So for those who want to argue, the next step is to go and do HB electrophoresis, which at the government facilities around, I think, between 6,000 to 8,000. And for those who have SHA, they can use their card. And in private facilities, about 12,000 to 15,000. So once we've checked you, we have confirmed you have sickle cell, we take you through counseling. Because here you're a parent, mmekuja na hata mjui. Now we tell the parents, this child has sickle cell, and this has come from the both of you. This is a genetic disorder that affects blood. And for the child to be born with it, wewe mama na wewe baba, mko na HB, hemoglobin S. Meaning hiyo hemoglobin yenu si ile kawaida ya round, iko S. In very simple terms. Na hii si death sentence. Watu wanaishi nayo. I've told you, there is a whole 80-year-old living with sickle cell. So, you try to remove the myths and beliefs that people have. Give them that confidence. Let them know that their child is going to grow normal. And then we tell them now that these drugs that you can use that can help reduce crisis. This is what to look out for. Mtoto akona macho ya yellow because hemoglobin iko low na anahitaji. Kama ni below, they say below 5, they need to be transfused. Kama ni usual routine, tunakuweka on folic acid. Mtoto asikose folic acid. Tunapeana proguanil ili asipate malaria, because unajua malaria attacks those very same cells. So it will make the condition worse. Itafanya HB irudi chini. Tunapeana dawa ya kuprevent malaria. Now on top of it, tunakupatia hydroxyurea. Hydroxyurea goes to improve the hemoglobin so that at least the flow of blood is easy, regardless of you having S-shaped. Ukipambia mzazi hivyo vizuri, they will embrace it and they'll be able. So here is where Zuwi Afya comes in. We are here for those warriors who cannot afford SHA for a whole year, 7,200. Even Victoria Annex are referring those who don't have SHA to us. Let no warrior go without medication. We are here to support you. I said, we do not have the funds, but God is making a way. Somehow those 520 in schools, in institutions, in various homesteads, they are getting. Today we've added 3. So we have 523. And we will not stop. We are still going out there. We're talking to people. We're asking anyone who has that chance to support us kindly. The warriors are here. Meshack is here. We have others in the organization. Go anywhere. If you go outside and ask, I have a sickle cell warrior, how can they be helped? You will be referred to me. And I do it with passion. I love them. I have fun with them. I dance with them because I tell them, you're just like me and you. And I try to show the community members, mnaona ati wako na disability, hawana kasoro. We had a beautiful event, a build-up activity towards the International Sickle Cell Day on the 14th. It is on our social media platforms. We did a free medical camp where we had 300 warriors. And this has brought another 300 warriors in Nyando who are asking us to go down there to give them service. We haven't accommodated them yet because already we have a number that is overwhelming us. But we are planning. We've done various proposals so that we are able to add them into our platforms. And we're doing this jointly with the government bodies because we also want to see, can they also set up clinics? The only challenge would be, yes, they're setting up clinics which are SHA accredited. The warriors cannot afford that. So those who are really high risk, I call them high risk, is hawawezi kabisa, they can't afford to pay SHA. They can come to us and we're able to give them medication. So we had a very beautiful activity. We had a medical camp and the crowning event for that day. And we are giving hope to the warriors. We had a fashion show done by the very same warriors. I wish you attended. It was amazing. The warriors, we had one who was amputated. We had Meshack. We are telling you disability is not inability. They catwalked. And let me tell you, it was beautiful. And we gave them certificates. We were able to award them on the effort. It was not about beauty. It was about hiyo kujituma they put on that day. These warriors are beautiful. And people just need to embrace them, understand them. Once you are stigmatized, bring them close, hug them, tell them they can do it. And if you are able, support them. Yes.
Okay. That's some wonderful job. I can't say that enough. You keep giving me reasons to say it over and over again. But then in your Nini, you've mentioned government a couple of times. I also looked up a bit of the information hapo kwa Ministry of Health. Nikaona government came up with the Afya Dhabiti or something, a program for these guys. Just how much is the government doing and where are we now?
Government, what I can tell you is you have to have SHA for you to get a service. They've set up something very beautiful. The Afya Dhabiti, Edu Afya, all those, sadly, they come with time and it has passed. So SHA was introduced. Sadly, they introduced the 1 year payment, and this is really hard for them. So as Zuwi Afya, considering that we are getting overwhelmed, we sat down with the team and came up with something. And this team compromises of almost 10 warriors. And the warriors were like, why don't we do like a revolving fund? This is not money that goes to the organization. This is money that goes to support the warriors. So we are working on a Zuwi Afya card, not competing with the government, because we are working in collaboration with them, and some of them are party to this same idea. So we have a Zuwi Afya card, whereby a warrior can pay as little as 500 bob every month. I mean, not 500, 50 bob every month. That's 1,500. It gives you a Zuwi Afya card. Zuwi Afya card gives you access to Zuwi's pharmacy, which, God willing, next month we want to make it Zuwi's medical services, whereby we'll have the sickle cell clinic there with sickle cell experts to be able to serve them. So in this platform, when you have a Zuwi Afya card, it's 50 bob only. Trust me, I feel that they can manage because we are also empowering them. So they'll be able to, Meshack will tell you, they'll be able to afford that 50 bob only. And once you have that 50 bob, your 1,500 caters for your medication. So as much as that is happening, so we won't have the burden of just buying them drugs because we're spending almost 3,000 to 5,000 per month. So I would rather we pay for them SHA. So they have the option of not most of them, some of them are outside. They are in the villages, in the communities, and we are in the CBD. However much we have days that we go to, we have assigned days where we go to this village, we go to this village. There are people who reach out to us and tell us this village needs support. We are a team of almost 25. So we're able to allocate everyone because we go for trainings. We're trying to sharpen our skills on how to take care of these warriors. And you can't do it wewe peke yako. You must do it with other people. So with the Zuwi Afya card, they're able to come there, get services. They have loaded. Hii ni pesa yao. Unajua, so wataifanya na bidii. They get services, they get their medication, and they go home happy. So I want this very same Zuwi Afya card. It will be used where? In specific facilities. Now, that's where other partners come in. I have been in talks with Avenue Hospital. I've been in talks with Siala Hospital. I've been in talks. LACOD are setting up a hospital, a 20-bed facility. We would love, support even the local people. It doesn't have to be always to the government. SHA, at the end of the day, it still goes back to the government. So in that place, I believe no warrior will have any challenges. They should be able, and pole we tutaanza kwenda mashinani, we look for places where they can. So with this Zuwi Afya card, we ensure, and these very same warriors will be the ones running the Zuwi Afya card project. Because they understand their fellow warriors. So government has set up the Victoria Annex. You have your SHA card, you go there, you are tested for anything and everything. Eventually, it's being set up into a surgical hospital for an inpatient, and also the warriors can get admitted there. So they have experts. They even have fellow warriors. Some of them are they're volunteering. Some of them are employed. Dr. Muyonga and her team are doing an amazing job. But one thing I noted is they're overwhelmed. It is just starting. I think it's 3-4 months.
3-4 months.
And the numbers are crazy. I was on radio the other day, Namlolwe, and I was being asked questions. And there's a lady who has a child. She's 8. Her child is from Busia. She wanted me to give her service. So they came all the way. I talked to the father who works in DRC. I convinced them to come. They have SHA. As I talked on radio, I kept telling the warriors, if you have SHA, because I know there are those who can afford, let them go to Victoria Annex. Those who are not able to afford, let me support them. But that doesn't mean that even if you have SHA and you come to me, I will still support you. Because you find most people don't want to go to the government facilities because they can't afford. Anyway, so she came and it was really sad. She came to my facility, the child was screaming. She told me the child had suffered a stroke. The mother does not understand. These parents don't even understand why they were sickle cell. So I took the mother through it. We went to Victoria Annex. I took the child there. Since I have a good relationship with the staff, at least I was able to take them through quickly. The only hitch was the SHA desk, because you have to register, like when you come in, the consultation and everything, you have to pass through SHA, and there's only one person. So there are a lot of people there waiting. So I processed everything, and I got them and left them at the clinic, where one of the ladies working there, Nancy Waliaula, who's doing a beautiful job, took over. She's a volunteer also for Zuwi Afya. I try to get the warriors into the team to educate us. We don't have all the information. We learn every day. So she got treated, but now the queue management is the biggest challenge. And that's why you find people prefer to go to private facilities. She ended up going back home at 9 p.m. But she called me grateful. One, the first time when I met her child, I realized her child is autistic. The mother told me the child suffered a stroke and started doing that. She got to learn what her child is going through. So you can imagine autism and sickle cell. She has suffered a stroke. She has 3 burdens. The mother is not understanding. So I gave her encouragement. I talked to her a little bit about mental health. And I told her, I will always be there. I call them every week. I follow up my warriors. I know them, 520, and I know them by name. I have a personal relationship with at least each one of them because they have come from somewhere. And she's grateful. So you see, the stories are the government is doing their best. So myself and Veronica, in the various spaces, we are going out there, we're advocating, we are trying to engage the government. Can these drugs either be subsidized or made free? Because they're essential drugs for survival. Yes, that is still a debate we are having with the government, and we hope over time. Recently, Unigen came in. They would love to build. They had an MOU signed with the governor, and very soon they'll be setting up a pharmaceutical company. They will be producing and making hydroxyurea, the dispersible tablets, because for the children, you get the capsules and you prepare the syrup. But Unigen is coming up with a dispersible tablet that these children can use with ease. So I can tell you the government is doing their very best. But as advocates, myself and Veronica, we are tunawasha moto, tunaeka moto kwa kuni. We are trying to see how we can work together to make it better. Yes.
Sawa. Yeah, I'll come back to you kwa our closing remarks. But before that, nataka nirudi kwa Meshack. Tuambie ulimit aje Zuwis na venye what journey, the journey yenye mmekuwa mkitembea na wao. How has it been?
Okay. Before that, I have to say it is a great moment once again. The process has not been easy. I came in contact with, I think was Liz. The one. Yeah.
She's a volunteer.
She's
She's
a
a
volunteer.
PWD. People, Yeah, persons with disability.
So I call her, and I meet up with I meet up with her, and she introduced me to the team. Yeah, it was a amazing moment because I had found someone who can stand with warriors. So in the team, we have been working together. Yeah, supporting the warriors. If I had a call that I have someone in the hospital, and she or he is a warrior, I need to rush there and see kind of medication which he or she is getting. Like last week, I was at Prim Care. There was one of our patient there. I had to attend there to see if she had gotten the blood because her HB was low. Yeah, she was given 2 units of blood, and now she is at home. Yeah, so the team is doing great, and the team is doing a great job. Yeah.
So, in our closing remarks, nataka Lily, I want you to talk to the parents there at home wenye labda hawako kwa hii crisis ama labda wako na hawajui wako kwa hiyo crisis. Talk to the community, talk to the government as we close.
Okay, one of the things Meshack just mentioned, we enlighten people. We have an MOU with the blood bank. We do a lot of blood drives, and we do a lot of advocacy and sensitization in schools, organizations. We are working on going to do the same with worship areas. Why worship areas? We believe, you see, this is where people go to tie the knot. And it is important, before you tie the knot, know your genotype. Is the man or woman you're marrying, does he have sickle cell? I know you won't, huwezi angalia mtu na useme, it's the same way you cannot look at someone and say they have HIV. Hatupimi na macho. We are trying to advocate for it to be compulsory, for people to be tested before you tie the knot, so that you know what journey you're going to walk through. We have experts
so it means
from
their children.
Max Cure, from Apollo hospitals. They come down. They are teaching couples who have sickle cell how they can get healthy babies. Yes, that is the first thing. Secondly, I mentioned that we are doing blood drives. In our blood drives, all the blood collected, and this is in collaboration with the blood bank, the Nyanza one. Any warrior needing blood, I am just a phone call away. Not just Lilly Wabala, but Zuwi Afya team. There's Meshack, there's Michelle, there's Nancy. You can reach out to us. And also Veronica of Tumaini Sickle Cell Foundation. When you reach out to us, we are able to get you blood wherever in Kenya. No warrior should die because of lack of blood. Thirdly, you need to understand your child's needs. If you see a child is ailing and you don't seem to understand what it is, it could be sickle cell and you have no idea, and you have no idea that it is in your lineage. So run to the hospitals, or you can come to Zuwi's pharmacy and we shall check for you, does your child have sickle cell, at a very affordable cost. Then also learn, I have a sickle cell warrior. Please do not stigmatize them. They are just like me and you. I mentioned we did a sickle cell, during the International Sickle Cell activity, we had a fashion show. Do you know they actually did it better than us? They showcased, they modeled, and they were beautiful. So they can do it. So what we can do, they can do it. They are not deformed. They are not disabled. They are just normal and need to be loved. So one thing people need to understand is get tested. Know your genotype. Beginning with yourself, Adera, you need to go and check for your genotype. So after this, I'm expecting to see you lead by example. Yes, and it would be a nice thing to do it on podcasts, to show guys this is how it's done. Yes.
To actually spice it up, we'll
Yes,
come and then we'll also accompany your team to
Yes.
one of your crisis calls
Yes.
and how you deal with your warrior.
And we'll test a sickle cell warrior, the one who's volunteered, and we'll test a person like himself. And then you get to see what it is. But I still advocate, let us get tested. Know your genotype, because it will save you. Another thing that is very important, schools. We are trying to advocate for sickle cell to be taught as a compulsory subject. Because if we learn, the various schools we've gone to, even the students don't understand it. And we support a lot of children in the schools. One of the things we do for the girl child, any child who is a girl who gets medicines from Zuwi Afya gets her dignity packs. You do
Correct.
not struggle. For free, we have the disposable pads and we have the reusable pads. They get it anytime you pick up your monthly dose. Those in schools, I have teachers. I have gone to Nyando Mixed. I have gone to Kisumu Day. I have gone to
Ojola.
Ojola. Just to mention a few. And all these schools, I talk to them about sickle cell, I raise awareness, and I pick up the number of warriors there, and we send the medicines to their teachers. So above all, sickle cell, you need to understand what causes sickle cell, what causes the crisis. They're not supposed to overexert. Temperatures. When it's too hot, hydrate. When you hydrate, you will not have crisis. When it's too cold, keep warm. Because if you don't keep warm, I mentioned the hemoglobin is compromised. So meaning you can get pneumonia, you can get very bad infections. So there are things that you need to understand. Another thing, you need to take vaccinations for pneumonia, for meningococcal, for flu, so that the immune system is already compromised. This helps to give them a stronger immune system so that they cannot be hit hard. Most warriors die of pneumonia. And people will say alikufa na pneumonia. Hii pneumonia ilikuja kwa sababu you are not taking hydroxyurea, therefore your body is not strong enough to form proper hemoglobin so that the infection doesn't go to hit various organs. So it is always about understanding. Lastly, I am available anywhere, whether it is school, whether it's institutions, whether it's families. I'm just a phone call away. My number is 0799 504 897. I'll repeat, 0799 504 897. As our slogan states, small steps, big impact. These warriors, will love them and will always be there for them. Asante.
Asante sana. Small steps,
Big impact.
She said that already. So that's all for today. Thank you so much for keeping with us. And as you said, keep learning, keep spreading the message, but most importantly, stay kind. Thank you till next time. Bye.
Asante. Bye.